Hi, I'm Dr. Anna Saylor with Every Family Chiropractic Center. And I just wanted to go over today is Wednesday. So, do you know what Wednesday is? Wednesday is Hump Day. So, yay! I'm Dr. Anna Saylor with Every Family Chiropractic Center. And I was just saying today is Wednesday, and Wednesday is Hump Day. So, we want to talk to you about a thoracic hump. So, a lot of women, and we hear it a lot of times in our office, that they're starting to notice, especially through here or right through here, a hump. And they want to know if it's genetic, if my mom or my grandma has a hump, so I'm starting to notice one, and if there's anything chiropractic can do. So one of kind of a couple of reasons why we also say it is common, but it's not normal, which means that it is fixable. There are things that you can do, things that we can do to help that hump. So if you are noticing an area here, especially, we see it more in women, we see it more as we age. A couple key things and a couple reasons why. Number one thing, we are in Michigan. Michigan has really crazy changing weather. And if you think about your body likes to be at a certain temperature, so 98.7 or whatever it likes to be at. So your body, you don't think about it, but your body maintains its temperature whether you're going from a cold room to a hot room or from inside to outside. Your body tries to stay at that same temperature. And you don't really think about it, it just does it naturally, just like the thermostat of your house. So if you have a really cold day and your thermostat, and then it goes to a warmer day, think about your thermostat flipping on, flipping off, turning on, turning off. Your body does the same thing. And the place it does it is one of these areas. So that longest vertebrae in this area, so that long vertebrae here, it acts almost like a rudder. So it goes on, off, on, off. And so anything that goes on and off over and over and over again starts to overwork, and then your muscles start to swell. So certain days, especially like today when it's really hot and it started out a little colder in the morning, you'll actually notice that this area of your body gets a little more swollen, which is really common. So if you think about something that's going over and over and over, working over and over again, your muscles are going to inflame in that area. We also notice it more in women because women, we tend to be a little colder blood, so we tend to be a little colder and we're always trying to warm up. So I actually see it a lot more in women than men. The other thing that affects here is your head forward posture. So your ear and shoulder, so my little skeleton guy, his ear and shoulder should be as aligned, it should be as close to alignment as possible. So for every 1 inch forward your head is, it adds about 10 pounds of pressure directly on your neck and shoulders. So if you are looking down a lot on a cell phone or you're working on a laptop right now and you're always looking down, it's going to take your posture and throw your head forward. It's going to stress this area. So now you have an area of stress and you have that area that's your hump is getting bigger and bigger. So we want to make sure that your posture is in a really good position, and we want to make sure that area, that overworked area, T1 is the longest vertebrae, so it actually is going to stick out more, and then that area over it is going to swell. So people are always like, well, how can we help that? Chiropractic. So for us, one of the things that we adjust all the time, especially on women, is it's just not one thing, it's a complex of things. So you look at it, if this vertebrae is moving a lot, we have to look at the vertebrae, we have to look at the ribs surrounding it, we have to make sure that your scapula, your shoulder blades are in the right position, we have to make sure that the tension in your shoulders are better. So we want to focus on this whole area. And most people know the rib, that you know that your rib's a cage. We know that it's a cage. But you don't think about it. Stress, too, is going to cause your sternum to go up, and it's going to cause your ribs to go up, too. So we want to adjust from the front and back. We want to make sure that that whole complex of areas is relaxed and is calmed down as much as possible. And we want to protect it, so we want to make sure your posture is in a good position. So definitely, just because you have a thoracic hump doesn't mean you have to have a thoracic hump. Doesn't mean that you have to stay with it just because your mom might have it or your grandma might have it. But there's something you can do about it. And we want to work on it. We want to fix it because it's also going to, if you think about your forwardness, if everything's forward, it's going to affect your heart, your lungs. It's going to affect your thyroid. It's going to affect a lot of different organs. And we want to make sure that you're able to breathe as much as possible. We want to make sure that you have movement as much as possible. We want to make sure that your muscles are relaxed. So if anybody has any questions, it is Wednesday. Happy Hump Day. There is way to fix it. So give us a call and we will talk to you soon. Bye, everybody. Have a great day.